Tonight on KQED Newsroom, our special guest, San Francisco Mayor London Breed, talks about how she's tackling the pandemic and crime on the city's streets. And more Californians could have access to health care as part of the governor's newly proposed state budget for the coming year. Our panel of reporters looks at that initiative and more. Plus, a visit to California's Wild West past. Well, at least the fashion of that era, in this week's look at something beautiful. Coming to you from KQED headquarters in San Francisco, this Friday, January 14th, 2022. Hello and welcome to KQED Newsroom. I'm Priya David Clemens. It has been a week of pandemic record highs across the nation and here in California. State health officials say 23% of professionally administered tests are showing up positive, with the number of new cases topping 100,000 daily over the past few days. Some school districts have closed their doors and gone back to school online, and Sonoma County has banned large indoor and outdoor gatherings for the next month. Joining me now to talk about the latest restrictions in her county is Sonoma County's health officer, Dr. Sundari Mase. Dr. Mase, thanks for joining us.
Yeah, thank you for having me.
So tell us about the status of coronavirus cases in Sonoma County now.
Yeah, we're feeling the same increase in case rates as every other county here in the state. We actually have a case rate now of 212 new cases per 100,000 per day. To put that in perspective, at the height of the surge last winter, we were at 58 new cases per 100,000 per day.
Wow.
Our test positivity is also 21%, and we have widespread community transmission at this time of Omicron.
All right, so you have just announced a new set of restrictions that are going to last for a month. What are the restrictions?
Yeah, so let me just give you some background. We find that the majority of our cases report having attended gatherings. And that's what we think is really contributing to the huge increase in cases and transmission. So what we've done is to put a limit on indoor gatherings at events of 50 persons, and for outdoor gatherings, 100, unless able to socially distance. So if there's a venue outdoors that is able to handle more people with distancing, they could do so. That's really the gist of the order, but also in our highly impacted vulnerable populations, like our skilled nursing facilities, we've put that limit to 12 for gatherings and events.
You're also encouraging people to stay home as much as possible.
Yeah, that's a recommendation that at this time with widespread transmission of COVID, that it's better right now not to gather, not to go places that could put you at risk, and to generally stay at home except for the essential sort of activities like doctor's visits and visiting the grocery store, things like that.
Do you think we're currently at the peak of the pandemic from the scientific research you're seeing?
We're not there yet. We're still seeing an increase in cases. We had close to 1,900 new cases reported yesterday in Sonoma County. So, and we've seen widespread outbreaks, in our skilled nursing facilities. We've seen more hospitalizations and deaths, our homeless population, at events. And all of that is very concerning at this time. So I think we're still in the upward trend.
So tell us about the metrics that the county is using to determine when the pandemic is, no longer a pandemic, or in other words, when COVID-19 is not a major threat to public health any longer.
There's a multiple different factors that go into this, but let me just say that for Sonoma County, one of our most concerning metrics is our hospital capacity. And our hospitals have all reached out and said that they have staffing shortages. They're seeing more people in the hospital with COVID, but also with other illnesses. And the emergency departments are backed up. It's really hard for our hospitals to get people out to skilled nursing facilities or to homeless shelters or even alternate care sites for people who are COVID positive or who are quarantining. So all these things are actually really important because they could impact the care for the community that the hospitals can provide. In other words, people who need to go to the hospital with other illnesses could find that there's a backlog, and that would really be a significant impact to the community.
All right. Thank you so much, Dr. Mase. We appreciate it.
Thank you.
To talk about
Last month, San Francisco Mayor London Breed declared a state of emergency in the city's Tenderloin neighborhood. She vowed to bring a police crackdown on the regular and open crime in that neighborhood.
And it's time that the reign of criminals who are destroying our city, it is time for it to come to an end. And it comes to an end when we take the steps to be more aggressive with law enforcement, more aggressive with the changes in our policies, and less tolerant of all the bullshit that has destroyed our city.
Criticism of her calls for increased police intervention came swiftly from the San Francisco District Attorney, Chesa Boudin, and other city leaders. The situation in the Tenderloin and the debate over how to handle it reveal deep political tensions in this deeply blue city. Joining me now is San Francisco Mayor London Breed. Mayor, thanks for joining us.
Of course.
Your move to increase police action has been criticized, as we just mentioned, by the district attorney and several progressive city leaders as a continuation of this war on drugs sort of policy that has not worked in the past. Now, policing is only one part of your plan, but it's a pretty prominent feature. So why do you think it'll work now?
Well, just to be clear, I think it's unfair that, sadly, many progressives in this city who are leaders have labeled this as a war on drugs. This is not about recreating or reemerging something that clearly is a failed policy. This is about striking a balance, because San Francisco has been an extremely compassionate city with numerous resources, in particular, the millions of dollars that we invest in a number of agencies in the Tenderloin in particular, which unfortunately are not working in a way that has led to the kind of results that we really want to see in this community. And it's not just law enforcement, but law enforcement is an important part of this, because the Tenderloin community in particular has gotten increasingly violent. There has always been challenges in this neighborhood, but it has increased significantly with the number of homicides, the number of people who have been shot, the number of people who have been stabbed, the constant random physical assaults on many of the parents and sometimes the kids and the elderly who live there. And so we have a responsibility to make sure that when those lines are crossed, when people are assaulted, when there's open air drug dealing out of control, that we deal with it, and law enforcement plays a role in that process.
Will law enforcement then be escorting people to the linkage center? This is a place for people who are struggling with substance abuse issues that they can go to get help. I understand it's going to be opening next week. Will law enforcement be bringing people there, or is this going to be completely voluntary?
Yeah, well, the goal that it's not necessarily going to be voluntary, but, especially if someone is, breaking a particular law and clearly is struggling with addiction, they will be given this as an option. And the goal is to have folks from our homeless outreach team and other resources we have that will be able to respond quickly and pick them up and walk them over or deliver them in one of our vans to the location. Because we want to keep that, kind of distinction between help and services and law enforcement. But the police are out there. They're giving people Narcan who would otherwise overdose. They want a place to take people who are struggling. And so this is just a part of the solution to get us on the right path and to not simply just walk by somebody who's struggling with addiction.
You've been critical of excessive use of force by police. How does the idea of increasing policing in the Tenderloin square with the idea of using fewer police and less force as a way to handle problems?
So at the end of the day, I gotta say, what San Francisco has done, what we have done in terms of turning things around in our police force with anti-bias training, with de-escalation training, with a number of new hires, which has made the department a lot more diverse. All the work that we have done has led to changes in our police department. Is it perfect? No. Are we going to keep working on it? Of course, because ultimately we want to make sure that our officers are there to serve and protect everyone, but they also understand how to do their jobs in a way that leads to the minimal amount of harm of anybody that's out there. And so I think ultimately, when maybe you're the person who unfortunately is assaulted, you want them there. You want them there to deal with the person who assaulted you. You want justice. With the families who have had people who have been killed in the city, they want justice. And so, but what we don't want is for officers to inflict harm unnecessarily so on people who may be innocent or have nothing to do with a situation. So I think this is really about a balance. This is really about making sure our officers are trained, that they want to work on these assignments, that they care about this work. And we've been doing a lot in our police department to turn things around.
Your frustration over this issue is very clear. I think it mirrors a lot of the frustration the residents of San Francisco and people in the surrounding counties also feel when they come and visit San Francisco. You declared this state of emergency because you said something needs to be done now. This has been going on for long enough. It has been bad for long enough. So you called for this immediate increased police intervention. But then, according to a report in the San Francisco Chronicle this week, it appears arrests have remained flat and police presence has not increased over the past month. So why has there been so little change if we're truly in a state of emergency?
Well, the fact is, Omicron was completely unpredictable. We've had a lot of police officers who would otherwise be out there on the streets in the Tenderloin that have been off work in order to quarantine. And so that's impacted not just our police department, it has impacted the fire department, the Muni and other city resources. We've had to bring in people to make sure that the initial shifts are actually filled and using overtime and other resources to do that. But my hope is as this surge begins to decline, we'll be able to add more officers to the Tenderloin community and do a lot more work in the coming week.
But then on the other hand, police presence did increase quickly and significantly in Union Square after the mass looting incidents in December. So why was the city able to respond so quickly there but not do the same in the Tenderloin?
Okay, again, as I said, at that time we weren't dealing with a surge. We weren't losing significant numbers of officers like we are now. And in fact, unfortunately, we've had to scale back some of the response, the police officers in the Union Square area in particular, even though there's still a presence, just like there is one in the Tenderloin. So I don't think it's fair to really attribute this to anything other than the fact that people are out sick.
Let's turn to another topic. The vote to recall 3 San Francisco school board members is happening next month. You've endorsed the recall of all 3. Why do you think that this recall is important?
We were dealing with the pandemic. We all got derailed. We didn't expect anything to perfect, but at the end of the day, prioritizing our children should have been, and of course safety, which is important, should have been at the top of the agenda, and in many cases it wasn't. In many cases there were oftentimes questions, concerns, issues, frustrations, and it's not even just about the decisions, it's more so about communication, it's about the role of the school board, it's about the need to, again, put kids first. And there were a number of failures. We saw the city during the pandemic. San Francisco has been praised for our response, for using data and the science to make really hard decisions that led to saving lives. And then on the flip side of that, criticized for just what was happening in the school board, which really should have been completely different than what they were dealing with. And so, look, my hope is ultimately that whatever the voters decide on the school board, my goal is to make sure that we continue to work with the school district and provide them with the resources and the support they need. Because ultimately, when we focus too much on ourselves and the politics, then the children lose. The children are struggling, they're already losing, and we need to do more, and we need strong leadership to help do that.
District Attorney Chesa Boudin is also facing a recall, and political observers have noted you've been critical of some of his actions. Why haven't you endorsed recalling DA Boudin?
Well, I'm focused on this first election. It's going to be in February with a number of decisions that are to be made. That decision is not being made by the voters until June. And so I'll make a decision closer to when that election occurs.
All right. We asked our viewers for questions, and one of them wrote in asking about housing. They wrote, how are you going to get the Board of Supervisors to pass a rezoning that will be compliant with state law and allow us to meet requirements for the upcoming housing cycle?
I am going to pray, and I'm going to also ask people to reach out to their members of the board. We In my office, we consistently try to push the envelope on housing production in San Francisco. So we're going to keep trying to work with the board and get some of this legislation through. My Cars to Casa legislation, which will allow for parking lots and gas stations and other underutilized spaces which don't currently have housing or not zoned for housing. That Cars to Casa legislation will save almost 18 months in going through a process.
All right, let's turn to the coronavirus. First, you've said San Francisco will not be following in Sonoma County's footsteps of introducing fresh restrictions in response to this current surge in coronavirus cases. Why not?
Well, because I think our data is a little bit different, and our capacity in terms of our ability to have ICU beds in our hospitals are a lot different than Sonoma County. We're just in a different situation, and we depend on our public health experts and folks who understand infectious diseases and looking at the data to determine what kinds of decisions we need to make as a city with regards to this. And this is not a decision that they believe is necessary at this time. And it doesn't seem to be a decision that might be necessary in the foreseeable future. We're seeing on the East Coast, the surge starting to decline there. And, their surge started to increase a lot sooner than ours. And we were preparing for that. But here in San Francisco, we're doing okay. And things are not completely out of control, even though we're seeing significant increase in the numbers of people who are infected with Omicron. We're not seeing our death rate increase. We're not seeing it increase significantly, and we're not seeing the hospitalizations get out of control where we don't have the ability to take care of people. So we're, I think, in a decent position. And if we get worse, then we'll make a decision at that time. But for now, we're okay.
London Breed, the mayor of San Francisco, thank you for your time.
Thank you.
Despite the pandemic, despite an increase in crime, despite log jams at the ports and rising inflation, California is once again looking at an optimistic budget picture. The $286 billion budget that Governor Newsom unveiled this week includes a projected surplus of over $45 billion and is aimed at COVID-19, climate change, homelessness, the cost of living, and public safety. I'm joined now by KQED Politics and Government Senior Editor Scott Schaefer and Washington correspondent for the San Francisco Chronicle, Tal Kopin, who joins us on Skype. Thank you both for being with us.
Good to be with you.
Yeah, so, Scott, we're once again in the position of having this very large budget surplus because California's economy continues to boom. What will this extra money mean for California?
Well, it's very good news, of course. And this is the second year of a big surplus. And just to keep it in perspective, Priya, $46 billion surplus is bigger than the entire state budget of a lot of states in this country. So it's a lot of money. It'll be spent on the priorities you mentioned, COVID-19, climate change, and the rest. And also a big idea, which Democrats have been pushing for a long time, which is to expand Medi-Cal to more adults, regardless of their immigration status. There's about 700,000 undocumented immigrants who aren't eligible for Obamacare under the federal rules. They will now, if this budget passes for the cost of about $2 billion, be able to access health care in this state. And that is a big deal. One thing that does strike me, though, is that so much of this money is spent reacting to emergencies, the climate change crisis, COVID, crime. And I was thinking back to the 60s when Pat Brown was governor and all the big money was spent on things like the big water aqueduct, the UC system, things that we still use today. And I'm not sure we can necessarily say that about this particular spending plan. That said, these are priorities that must be addressed.
Well, I want to pick up specifically on the hot button proposal about Medi-Cal. Tal, you wrote about this week. If it's adopted, it would make California the first state in the nation, as Governor Newsom likes to say, to offer health care to all low-income residents, regardless of immigration status. Tell us how you see this proposal playing out.
Yeah, so a couple brief details that Scott didn't go over. It's $2 to $3 billion per year, so that's an important detail, and it's not going to start before 2024, so it's not immediate. And the state has already extended this to senior residents who may or may not be undocumented, and already covers young immigrants. And so this is filling the gap. It's adults who were not, below 26 or above 50. But the other numbers he mentioned, this sort of plugs the gap. It's interesting. I was calling around about this, and what really struck me is how much this kind of puts California at odds with most of the country. Aside from perhaps New York, most of the country is restricting when it comes to immigration, not expanding. And I spoke with sort of a center-left, immigration advocate, policy thinker, who said, this is great. This is California doing its thing. But it's not necessarily what's going to play well for suburban swing voters in some of the rest of the country. And while this may really be welcomed in California and something that advocates in California have been pushing for years and years and are really heralding as an important investment in the communities that have gotten the state through the pandemic, there may be backlash elsewhere in the country. It really provides Republicans the caricature that they want to portray of sort of the left to then run on in the midterms. So it'll be interesting to see that dichotomy between sort of what is actually a really smart policy move for the governor in California versus how it's going to play in sort of the national discourse and the rest of the country.
Because this is support of undocumented people here in California in particular is what you're talking about.
Yeah,
there.
But Tal's of course correct. It is controversial outside California. Here, not so much. So while politicians, around the country and Fox News may criticize Newsom, and there's legitimate things to criticize, it's not that controversial among voters in the state of California, at least statewide.
Let's go to the opposition in general, to the proposals that he is putting forward more broadly in this budget. What are you hearing, Scott? Is there opposition?
Well, of course. I mean, Republicans who really are, I don't want to say irrelevant, but largely irrelevant in Sacramento because the Democrats have a 2/3 majority in both houses. But, they don't like all the spending. They'd like to see more of the surplus go back to voters, to people, to voters with, rebates. And there may be some of that. We'll have to wait and see just how big the surplus gets. They'd like to see more money spent on things like water infrastructure, water storage. They really, really don't like this expansion of Medi-Cal for undocumented immigrants. But, even within the Democratic Party, there are disagreements over how much should be spent fighting crime and how should it be spent. There are disagreements over health care and whether or not single payer, which is now making its way through the legislature, is a good idea for California. So there's criticism from the Republicans, but there's also a lot of disagreement, or at least some, within the Democratic Party.
Tal, how does federal money play into all this? What's already come from D.C. and what do we expect in the future here?
Well, it's kind of funny to think a year ago, the tone in DC was we have to pump out so much money to state and local governments because they're floundering. And here we are talking about California's massive surplus and how to invest it. And there's actually more money on top of that. They did pass COVID relief. The bipartisan infrastructure bill is going to, over the next 5 years, pump billions into California for roads, bridges. There was an announcement today, and there may be more COVID relief coming. So there's actually a ton of federal money that's on top of what the state is also announcing in its budget.
All right, and then Scott, COVID continues to rage throughout the nation and the state, but the specific coronavirus sick leave relief is gone. We don't have that anymore. Is there any indication it might be coming back? The
governor and the legislature are talking about it. It expired at the end of September. There is talk about adding some days. The question is, how many days? Who pays for it? Businesses don't want to do it. They feel like they've already, given it the office, so to speak, and they're helping to make customers and workers safe, and it's costing them money. And so this will be a negotiation. Right now in the middle of the surge, you really need that sick time. But, next month and in, March, who knows? Because the epidemiologists are saying we may be kind of through the worst of it at the end of January.
Knock wood. All right, Tal. One last topic before we go. We're going to turn to a California Congress member, Eric Swalwell, and his lawsuit against President Trump that's related to the January 6th insurrection. And Tal, you followed the hearing in court on Monday. Tell us about this case and where it stands.
Yeah, so Swalwell has sued independently, and his case is being heard with another group of lawmakers. That group actually includes Oakland Congressman Barbara Lee as well as a sort of supporting member and some Capitol Police officers. And they're trying to, in court, civil court, hold Trump and some of his associates liable for the insurrection that happened on January 6th of last year. And on Monday, the court heard what's the motion to dismiss phase. Basically, he is now weighing whether or not this lawsuit can proceed. And there's some really thorny constitutional questions here. What are the boundaries of presidential immunity? What are the boundaries of the First Amendment? Does this violate them? Swalwell and his team are arguing, if not this, then what could possibly merit, an exception to those limits? But Trump's team is saying, you know what, it's almost absolute that when the president is in office, he's immune from suits, and First Amendment rights are extremely broad, and these were the actions of other people. So
yep, we'll be watching where that goes in the next few weeks. All right, Tal Kopin with San Francisco Chronicle, Scott Schaefer with KQED. Thank you both.
Thank you.
Thank you.
This week's Something Beautiful is Bauman's Western Outfitters in Livermore. We don't usually feature a store in this segment, but Bauman's has a strong local history. It's been family owned for 140 years. So if you want to visit a piece of California's Wild West past, check out their selection of jeans, cowboy hats, and boots. And that's the end of our show for tonight. Thank you for joining us. If you want to get a look behind the scenes, then please hang out with us online too. KQED Newsroom is on Twitter and Facebook, or you can email us at knr@kqed.org. You can always reach me on Twitter at Priya D. Clemens. And we will see you right back here next Friday night. Have a great weekend.